the themes that I am going to be weaving into the content this year is specifically around hope. And Adam, when we were talking about this episode, you said, well, maybe this isn't the hope that you're really thinking of, but
Yeah.
I think that we have a really great message of hope for employers. And that's exactly the kind of hope I'm going for, by the way. So what is your message of hope for
Yeah.
employers?
So a few layers. I mean, the first is I think employers have an unbelievable opportunity to change the course of healthcare for millions of people across this country. And one of the things I love being in the role that I have today is being able to talk to people that are passionate about making a difference in that. And so if you're out there in the world and you're listening, like you really have a huge opportunity to impact people's lives. And I think that's neat. I think one of the problems we deal with today is that so many of the solutions that exist and so much of the infrastructure of the healthcare world just happens too late. It's all this process of a whole bunch of care happens. People have a whole set of call them crisis events for lack of a better description. And then after all of that's over, we're trying to come up with ways to engage them. And that has never worked. I mean, we have 50 years of evidence in the United States that type of approach hasn't worked, and it's probably not going to change. And there's a number of solutions that I think maybe are a prettier or slightly better version of that, but I don't think they're probably going to change things a lot either. What I think you really have to do to make a difference is you have to start looking at how do you actually integrate what an employer's healthcare strategy is with the actual care moment that happens for an employee. And that's really what Everside was designed to do. I talk to folks every single day about what I call employer-centric healthcare. And what I really mean by that is you have your set of strategies. You've got a wellness program. You've got a set of point solutions. You've got a set of interventions and incentives that are important to you. In the normal world of care, the providers that your employees are using don't know about a single one of those strategies. They've never heard of it. They don't know anything about it. And how could they, right? Like you're not in a world where that would be a viable thing. Well, in hiring Everside, you actually do bring those two things together. And we ultimately have the ability to say, all right, what are the elements of your strategy that are now relevant for this particular patient? And at the moment that a patient is actually being treated, the moment when they're engaged, the moment when they're thinking about what do I need to do to get better, to be able to connect for them in that moment, all right, here's the right care recommendations. These are the right prescriptions that you need. This is the rest of your care journey. But also, these are the elements of the employer package that are relevant for you. Believe it or not, you end up getting much better adherence and much better adoption in those kind of moments. And I think for an employer, that should represent a real layer of hope that there actually is a way to make those things be connected rather than being as disconnected as they are today.